My topic is whether AI ECG can predict cardiovascular outcome and mortality. It is well established that biological age reflects cardiovascular disease and mortality better than just simple actual age, chronological age. So there are many studies about this, including like this molecular and cellular genetic biomarkers and functional and structural markers. But it is very difficult to understand and interpret about cardiovascular disease, especially for healthcare provider and users. So I think ideal biological age indicators should be easily accessible and safe, is reliable and accurately predict morbidity and mortality. So in terms of this point, the ECG have many advantages and strengths. Because ECG has offered valuable insight, especially cardiovascular disease in heart disease. So large-scale ECG digital data is either substrate for deep learning AI application for cardiovascular disease. So AI ECG can be a powerful, non-invasive biomarker. The aim of this study is to investigate whether AI ECG heart age prediction using large-scale 12-read ECG raw data could predict cardiovascular outcomes and mortality. We used over 500,000 ECGs at our hospital from 2006 to 2012. We trained an internally validated ratio of 8:2, and then we performed externally validation through this holdout data set. This table shows the baseline characteristics. We did not use just the simple ECG data, image. Instead, we use ECG raw data and extract it from our hospital server. And then we put this large data, our developed this AI algorithm by multi-head attention module. This deep learning is characterized to augmented is magnified to improve accuracy and performance status. Throughout our deep learning algorithm, you can see the heat map. This heat map shows the correlation between the AI estimated biologic is the heart age and chronological age. You can see the very well correlated, and the mean absolute error, that means the gap between chronological age and AI heart ECG. So the MAE is 5.8 years. Based on this MAE in our data, we classified the patient into 3 groups. Number 1 is age gap more than 6 years old group, and number 2, within 6 years group, and less than -6 years group. This is the main result of our research. Left graph showed you can see the adjusted cumulative incidence Cox regression curves. You can see the blue line is the age gap more than 6 years have a higher incidence in all-cause mortality and cardiovascular outcomes compared to other 2 groups. Right table shows a hazard ratio of clinical outcomes. Even though adjusting traditional risk factor, diabetes, hypertension, heart failure, stroke, MI, and CKD, you can see the age gap is more than 6 years older group have a 1.6 to 2.2 of hazard ratio in all-cause mortality and cardiovascular outcomes. And subsequently, we analyze this hazard ratio spline curve according to age gap. You can see there is non-linear and J-shapes association were found in between the all-cause mortality and age gaps. And interestingly, is a little different. Looks like a little difference is between the sex different men and women. And additionally, we analyzed ECG pictures based on AI ECG hot age. You can see that the mean of PR interval and QRS duration and QTC is statistically increased according to by AI heart ECG. So in conclusion, we developed a deep neural network to estimate AI ECG hot age using a large-scale 12-read ECG. This AI algorithm indicates the discrepancy between the AI hot ECG and the actual age was associated with all-cause mortality and cardiovascular outcomes. And ECG pictures demonstrated a significant change in PR interval, QRS duration, and QTC interval as AI ECG hot age increased. So our model could be useful in understanding and motivating patients regarding their cardiovascular risk, potentially leading to better lifestyle modification to improve the primary prevention of cardiovascular disease. However, for the study are needed to be useful in real-world clinical practice. Thank you for your attention.
Thank you very much for this interesting information. I don't know if it's any comment from the audience. If no question, I just have two comments. One is that you have a very young population on average, like 47 years old, so in the average of the age. And this information is very interesting, but sometimes I feel like it's a little bit scaring, because why do you know to know your heart age? And the other thing is your groups are well balanced in terms of sex. My question is, would you find any difference between men and women in the risk of cardiovascular disease or any difference?
Thank you for your good question. Number one, you're right, mean age is middle of 40. Because our data is 2006 to 2021. It's real world data. It's in our hospital data, but it's mainly we health examination center data mainly included because we general population test. And second question is, but this real data is I think reflect our real world ECG data because this is over 500,000 data. But this is you're right. We need a further study in elderly patient is definitely. And the second question is sex difference is very interesting. We analyze this because we know another medical field such as BMI and mortality and blood pressure and mortality as very similar finding, J-shapes phenomenon. But we don't know the exact mechanism. But many paper and many others is demonstrated is in possible mechanism is sex hormone such as estrogen deficiency after the menopausal women is men and women is different there definitely. So we need more research.
Okay, thank you very much. Let's move to the next presentation.
Okay, so it's my pleasure to present Dr. Avi Saba from Israel.